It's the dawn of a new decade. You can be you again with Shatkin Mini Dental Implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Here's how Shatkin Mini Dental Implants will change your life.
I've had problems with teeth.
I couldn't eat almost anything.
I'm gonna go and get this done.
There was no pain. I was very comfortable.
It's just unbelievable what it's done to my life.
And it makes you feel good. It does.
Kind of gave me my life back.
Many dental implants made me feel like me, made me feel the person I knew I could be and always was inside.
I would recommend it to anyone.
And now I can smile and show the world. Literally changed my life.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. We are talking about the mini dental implant procedure. It will change your life, and I am welcoming Dr. John Coolican from Mint Mini Dental Implants, serving northeastern Pennsylvania, Scranton, Wilkes-Barre, and everywhere in between. And we're going to talk about the mini dental implant procedure. It's something that will change your life, change your look. You can be you again. The mini dental implant is 5 times less. It's less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. You will have a better life with your family and friends without the fear of those dentures coming out. The mini dental implant is FDA approved, and Dr. John Coolican, we can talk about the mini dental implant by showing what a conventional implant looks like versus the mini with the example that you have for us.
Absolutely, John. This hole here shows the hole that is made in your jawbone to place that old-style traditional implant. It is several times wider than the little pinprick that is done in order to place the mini dental implant. The traditional requires much more healing and generally involves 2 or more procedures over several months in order to have that new tooth or denture stabilized. By contrast, that mini dental implant is threaded into place and allows for immediate placement of the denture or the new tooth. It is an immediate result procedure.
So the mini dental implant is a revolutionary technique. It will change your life. You can be you again.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I'm able to talk and speak with confidence again.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
When I go to the VA, I can give them a big old smile.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
It brought a lot of confidence back to me.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done to my life.
It kind of gave me my life back.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Now we're going to talk about the denture. And if you have a lower denture, many of you who have that are probably used to the fact that it swims around on the bottom of the gum. The mini dental implant will stabilize your denture. Show us why.
There's over 50 million Americans that suffer from wearing removable dentures, and the vast majority of those people have nothing to hold it in. However, with the advent of the mini dental implant system, we can take that person that's wearing that lower denture and in a simple 1-appointment procedure, place generally 4 mini dental implants in the gum, make you a new lower denture that now incorporates what I'm going to call micro-housing or O-ring attachments. That denture then goes in and snaps right into place, and now you have immediate security and comfort in chewing your food.
That swimming on the bottom of the gums must just be so embarrassing if the denture falls out. And the mini dental implant, that titanium post, is what secures the denture in place.
These titanium implants are very biocompatible. They snap into place. You have a solid fit, solid snap. These are removable by you on a daily basis, but you're not going to have to worry about getting any type of suction or denture glue or that goop that people are so uncomfortable managing every day.
That's the most important thing you just said. The goop is gone. Odds are if you have a lower denture, you probably have an upper denture. And as we talked about earlier, that sense of taste is now going to be able to come back because the palate is going to be exposed with the mini dental implant on the upper denture. Show us why.
Most people that have a lower denture also have an upper denture. And many times when I see a patient in my practice, the first concern will be that lower denture. But eventually, after you see the great results we can get with the retention and stability of that lower denture by utilizing the mini dental implant system, they'll come back and say, Doc, what can you do about my upper denture? And we can do a lot with that. We can take that upper denture, remove the palate from the upper denture. This is the area that most people complain about: gagging, loss of taste, loss of sensing hot or cold items. Remove that area because we're not relying on suction with the implant overdenture. Generally, we'll place 4 to 6 implants in the upper jaw, and similarly, as I showed you on the bottom, that denture then snaps into place. No more goop and comfort.
And you know, if you have a denture, some people may think, well, that's just the way it's got to be. I have a denture and I'm going to resign myself to that. But it doesn't have to be the way it normally is. And no matter what your age, you want to be able to taste the food that we love here in northeastern Pennsylvania.
This is an example of what I'm going to call the semi-removable product. This is called the Fix on 6. Again, we're using an upper jaw. We're placing generally 6 implants. And as you can notice with this item, this is all what I'm going to call zirconia porcelain. This is solid material. This is not like the denture tooth and the denture, and we have none of that pink material that you see in your denture. This material is stronger than your natural teeth.
So this is a real step up from the denture. Now this mini dental implant almost has that, well, it does have that look of being like a full set of teeth.
Absolutely. You have a full set of porcelain teeth. We then snap this into place. This is not removable by you at home. I will see you periodically to remove this and do maintenance on this, make sure that your home care is good, that everything is doing well with that.
So the plastic from the denture is gone in this instance, and those teeth can be upper or lower.
Absolutely. This will work on either or both.
So if God gave us our baby teeth and then our adult teeth, Dr. Coolican, you're going to give us our third set of teeth with really the most premium mini dental implant example.
This is the gold standard in all of mini dental implant dentistry. This is called an implant roundhouse. Again, this is that super durable, super aesthetic material that we've talked about with the last service that I offered you. In this is a permanent restoration. This is like growing a brand new set of teeth all in one simple visit. We add additional implants, mini implants all the way around. These beautiful zirconia teeth are prefabricated and customized to you with your approval on the shape and size of the teeth. And again, in one procedure, I can place the implants, again, in a very conservative procedure, and cement these beautiful teeth in place. You come in with that denture or no teeth at all, you can walk out with this beautiful set of teeth.
And you'll work with the patient because this is a permanent replacement. So you'll work with the patient if they have teeth that need to be removed to prepare the mouth for this exciting look.
Sure, John. A common procedure I do is I'll see a patient that has had terrible issues with their teeth their whole life. They've known that. They knew the day was coming when they would have to do something. They just didn't know where to go or who to see or what to get done. I will see those people, and with a little bit of effort getting things arranged, but in one visit generally, I can remove many or all of those teeth that need to be removed, place those implants, and place these teeth all in one visit. Again, you can walk in with those teeth that are not healthy, not in good shape, and walk out with a beautiful set of teeth all in that same visit.
I was in a car accident. My front tooth cracked. I'm definitely embarrassed to smile. I got mini dental implants. It changed my life because it made me feel like me. Like I can smile and feel like Ashley. I just want to say thank you.
You can be you again with mini dental implants. I'm Dr. John Coolican. Call me today for a free consultation and give me the opportunity to change your life.
I'm more than happy. I'm ecstatic.
Now we've talked about dentures and we've talked about how the mouth will look terrific with these new teeth, the mini dental implant, because if you have teeth that are in the back and you're looking in the mirror and you're saying, well, I've got something that's happening in the back of my mouth. It's out of sight, it's out of mind, nobody's going to worry about it. Well, really, it's very important because those back teeth are the teeth that are used to chew the food and really get all the nutrients out, and the mini dental implant will help.
Many people say, well, I only lost one tooth on my lower right side, or I lost 2. I can still chew my food, but what a lot of people don't understand is when you lose 1 or 2 teeth, the teeth above it, for example, now serve no purpose. So if you've lost 2 teeth on the bottom right side, those 2 teeth directly above it now serve no function. So you've now lost the equivalent of 4 teeth of chewing. It's very important to replace back teeth, which are your chewing teeth. And in this example here, we can place multiple mini implants in an area. Again, this is done in one visit. Have pre-made your beautiful zirconium porcelain crowns. These are cemented in place. Again, you come in for one short visit. These procedures are done very safely and very simply and very painlessly with Novocaine. Walk out with those beautiful teeth.
And if you have a single tooth, maybe somebody has a car accident or a hunting accident or a fishing accident, or it's a tooth that just goes bad, the single tooth option is something that the mini dental implant will offer the patient.
The average patient I'll see would be someone that has had damage to their front teeth or lots of fillings over the years, and they'll bite into something and it won't even be something especially hard, and all of a sudden the tooth breaks off at the gum line. What now? Oh my goodness. And I'll see that patient and I'll be able to talk to them about what I can do with this, which is I can remove that tooth, place the mini dental implant, and place that first healing tooth right on all in one visit. They come in with that broken tooth, they can leave with a beautiful tooth, a beautiful smile.
In one day, in your office at Mint Mini Dental Implants. And these are teeth that are made in America and custom made for the patient. So this is not something that arrives in a box and it's one size fits all. That custom tooth and all of the mini dental implants are custom made for the patient.
The laboratory I use in Buffalo, New York, Shack and Fursk, is an expert in making all these products. Our staff will talk to you about the color and design necessary to match your other teeth, or if we're doing full mouth restorations, we'll build you a brand new smile.
The mini dental implant procedure is going to change your life, and Mint Mini Dental Implants is where you want to go. Here's the address, 360 Kidder Street, Wilkes-Barre. Give them a call at 570-314-9177 and online at mintminidentalimplants.com. Mint Mini Dental Implants, serving all of northeastern Pennsylvania. And let's get to know you, Dr. Coolican, a little bit. You are from this area.
I am. I'm born and raised in Scranton. I'm a second-generation dentist. I have two sisters that are hygienists. I attended the University of Pittsburgh School of Dental Medicine, and my residency was at the Medical Center at the University of Pittsburgh and at the VA hospital system in Pittsburgh.
And you say second generation because your dad was a dentist.
My dad worked 50 years in dentistry, and when I came back after school to Scranton, I associated with his office, and we worked together for many years. And subsequently, he became my employee.
You had talked to me a little bit prior to our recording that when you first started, you were sort of there filling in a little bit, and that's what really inspired you.
Oh, absolutely. When I was in college, my intentions were to go to medical school. I didn't know anything about dentistry. And my father had called me on a particular time and said that his dental assistant was no longer available to help him on Fridays. And would I fill in? And I did that for several months during my junior year and got to know the names and the faces of these lifelong patients of my father's, the procedures that were being done. I fell in love with dentistry at that time. And at that moment, I applied to dental school and continued on and never looked back.
So I'm sure your dad's very proud of you.
I hope so.
Tell us about your family.
Oh, I have three beautiful daughters that are all in the Scranton area. My oldest daughter, Megan, graduated college recently, and I have two in college now.
That's super. So you're a northeastern Pennsylvania guy, through and through,
Absolutely.
helping everybody here in the great state of Pennsylvania look their best with the mini dental implant. And Pennsylvania, where we're at, Scranton, Wilkes-Barre, is not too far from Buffalo. You know, you shoot up Route 81 across the thruway. You mentioned Dr. Todd Shatkin earlier when you're talking about the mini dental implant. Dr. Todd Shatkin is somebody who has really revolutionized this procedure, and you zip up to Buffalo to get the latest technology and bring it back down.
So in 2004, I started coming up to Buffalo, and I've been coming up ever since to learn these techniques and participate in these surgeries with Dr. Todd Shatkin, who has done more of these procedures than anyone in the world.
And you bring all of that technology here, and you're constantly learning. So imagine those days with your dad early on to where we are now with the mini dental implant procedure. It's revolutionary.
Mini dental implants are the biggest single change in dentistry in the last 30 years. They are the present, and they certainly will be the future for dental implants.
And the mini dental implant procedure is going to change your life, and Mint Mini Dental Implants is where you want to go. Here's the address, 360 Kidder Street in Wilkes-Barre. Give them a call at 570-314-9177 and online at mintminidentalimplants.com. You'll do free consultation, won't you, Doc?
Oh, absolutely. I get excited about when patients come in to discuss their issues and what I can do for them. I will talk about all the options available to the patient.
And a second opinion, too. If somebody's out there and they have a dentist, but they're thinking about the mini dental implant, they're watching Innovations in Health right now, and they're talking with their family about that opportunity, you'll do that second opinion.
Many of the patients I see have had other consults for that old-style traditional implant. They've been told that they've lost too much bone over the years due to gum disease, periodontal disease, and the fact that they've been wearing dentures for so many years, that alone has caused the bone to become very thin. However, with mini dental implants, many of those patients, 90+% of patients, I'm able to help in a way that the old-style traditional implant cannot.
You are making the mini dental implant procedure affordable. Tell us how.
For patients that need lower monthly payments, my office staff is set up and well trained in giving you all the options, and we can get answers literally within minutes for financing the lowest possible rate over the longest term possible in many cases. The goal is for everyone I see to possibly make this happen and enjoy the benefits of mini dental implants.
And when you come into the office and you take a look at some of the technology that we've talked about with the mini dental implant, and now you have what's called the cone beam technology. It sounds like a science fiction movie, but that gives you the opportunity to really dig deep into the patient and take a look and see where that mini dental implant is going to work.
Cone beam technology is state-of-the-art and is necessary in diagnosing and treatment planning all implant procedures. It tells me exactly where we can place implants, what size implants, to utilize the best materials and the best implants to give you the best support and the most beautiful smile.
So the Mint Mini Dental Implants is where you get the latest technology. It's going to change your life. You know, we talked about all the food that we love here in northeastern Pennsylvania, most particularly all the smoked kielbasa that we enjoy. We say that because if you really want to enjoy life and enjoy the foods that we love, the mini dental implant will help make that happen, and you don't need to accept the fact that you're going to have soft foods with dentures anymore. The mini dental implant procedure will really bring your sense of life back, and I think with this, Doc, it's time to maybe talk about some of the people that you serve, some of your patients. Who are the people that come in? I see all types of people. I see firemen, I see school teachers, clergy. I see young and old. I've had patients from 18 to 104. 104. Tell us about that patient. Her name is Ruth. Actually, I'm working with Ruth again currently now. Ruth came to me as a new patient when she was 99. Wow. She was taken by her 78-year-old daughter to my office, and she had concerns. She had several teeth left on top, and she's like, what can I do about my smile and my upper teeth? And you know, at that time, this was 5 years ago, I thought, oh, maybe just a regular old denture, and which was a big mistake, I have to admit at the time. But she stopped me and she said, listen, she goes, I don't want one of those dentures. I don't want something that's going to fall out of my mouth. I don't want to have to use that glue. And I heard her, I understood her, we worked her up, we placed implants at that point. And just recently now, some of those teeth, natural teeth she had at that point are going bad, and we placed additional implants. She's doing terrific. She's denture free. She's 104 years old. The point of the story here is you're never too old, John. You're never too old for these procedures. If you're in reasonable health, even if you're on a number of medications, these procedures are so non-invasive that most people can benefit from mini dental implants.
It's bad going through life having to cover your face because you're embarrassed of your teeth. I wasn't comfortable at all. I didn't want dentures. I had the fixed on 6 done. It was easy. It literally changed my life. I can eat anything now. I can smile, I laugh. I don't have to cover my face anymore. It was awesome.
You can be you again with mini dental implants. I'm Dr. John Coolican. Call me today for a free consultation and give me the opportunity to change your life.
You have a gentleman that you have recently helped as well.
Sure. So this gentleman actually in 2007, he had come in, he had been wearing upper denture for a couple of decades, I believe. I said, how about this? How about if we place a series of 8 to 10 of these mini implants up here in that very conservative procedure, and place the zirconia porcelain bridge cemented in place. He went for the procedure. This is 14 years ago now. I've seen him periodically over the years for maintenance and viewing. He's doing terrific. He has a great smile, no denture glues, no broken teeth, no broken denture, enjoying food, enjoying life.
And there's no better testimony about what Dr. Coolican does with the mini dental implants than to actually hear from the patients themselves. Let's take a look.
I couldn't chew on my right side of the mouth. There's no teeth there. How could I?
I was having a terrible time with them.
People had beautiful smiles, and I wanted that too.
I just couldn't eat with it at all.
I'm very, very pleased. They have made such a difference.
They feel wonderful.
There was no pain.
It's been a wonderful experience.
I absolutely love them. I've never been so happy with the results.
Just everything has been wonderful.
I could eat better. I could chew. It's the best thing I ever did. Beautiful. I love it. Perfect. And I'm so happy. I've never been so happy.
I feel great. I look great.
This was the best money I ever spent for me.
I can't say how happy I am that I've made this decision.
If anyone needs dental work out there, come see Dr. Coolican. I absolutely love them and would recommend it to anybody.
Those are amazing testimonies, Dr. Coolican, from your patients here in northeastern Pennsylvania. You must be very proud when you see those people and how you've changed their life, and you're bringing so much back to them.
John, everyone wants to enjoy a smile, a beautiful smile, and that's what these procedures can do for them.
We talked a little bit about the conventional versus the mini, and if you've just joined us on Innovations in Health, we've been talking about the mini dental implant procedure. Early on, we showed you some models. If you've been with us for the whole program, you'll want to watch again, because this really, if you're thinking about the procedure, this really makes it special. And tell us about that with this example.
John, again, this mini dental implant is such a minimal procedure. We're making a pinhole, very small hole in the bone, and threading that implant in a very quick fashion, as compared to a traditional old style implant where drilling a hole much wider, much deeper, much more discomfort, and much more healing time involved with that implant procedure.
If you have a lower denture and it's swimming around on the bottom of your gum, no need anymore. The stabilization is going to be there with the mini dental implant.
That's right, John. Probably the most common procedure is that person that's been wearing a lower denture or not wearing a lower denture because they put it in a drawer because they're not able to chew with it. I've had patients describe this to me as trying to bounce a hockey puck in their mouth. With this procedure, the mini dental implant procedure, we can place several implants on the lower jaw, take that denture and snap it right into place. No denture glues or adhesives or any of that gook.
And like we said earlier, the goop is gone. And if you have a lower denture, odds are you probably have an upper denture. But as we talked about earlier, those foods that we love here in northeastern Pennsylvania, that sense of taste, the cold, the hot, the sweet, the sour, all coming back with this.
Oh, absolutely. This is a fabulous procedure. When we can take that person that's been wearing that upper denture and be able to remove the palate, remove all that plastic on the roof of their mouth so they can taste their foods. There's taste buds up there. They can sense hot and cold, and also remove that sense of gagging many people have with wearing a traditional upper denture. It's a great service. Again, we can place 6 implants in the upper part of the jaw and make this snap-in implant denture. Beautiful.
And imagine again that sense of taste, biting into a luscious, juicy steak, corn on the cob, apples that are grown here, fruits, salads, vegetables, all of that sense of taste is coming back. But if the mini dental implant for your denture isn't enough, Dr. Coolican, you have another example.
An upgrade from the denture with all that pink material and plastic is getting into a completely different material. This is solid zirconia, like diamond porcelain.
Actually stronger than the teeth we are given.
Absolutely. This is very strong material, virtually unbreakable. This is called a semi-removable appliance. This is something we can make using generally 6 to 8 implants on top. It can also be done on the bottom. This is custom made of the color and design that we talk about. This is snapped in place. This is not removable by the patient on a daily basis. I will see the patient periodically to look at it, maintain it, confirm everything's okay. But this is a semi-removable appliance.
And if God gave us our baby teeth and then our adult teeth, Dr. Coolican at Mint Mini Dental Implants is going to give us our 3rd set of teeth with this example.
Oh, the implant roundhouse is the gold standard of what we'd like to do in mini dental implant dentistry. The idea is to remove anything removable from the patient's mouth, and with this technique we can give you a brand new set of teeth like you were 20 years old again. We place additional implants, again, all in one conservative surgical procedure, one visit. Those beautiful porcelain zirconia teeth are cemented in place. These teeth will not come out. You brush and water pick these teeth comfortably. You have a new set of teeth.
And the mini dental implant procedure, everybody, say you have a new relationship you're starting or a new job, and I've had some dental work done, you really do feel better about yourself. So it's worth the investment, and we make it affordable. If you have teeth that are in the back and they're missing, and you're thinking they're out of sight, out of mind, those back teeth are very important, not only for the shape of your mouth, but most importantly to chew your food and get all the nutrients out. So the mini dental implant will help.
So important to have the chewing teeth, which are generally considered your back teeth, replaced. In this example, if we're missing a couple of teeth here, in one simple procedure, I can place implants and place your custom-made porcelain zirconia teeth in there, restore chewing on that side, and now the teeth that are above this have something to chew on as well. Very good procedure.
Great procedure, and it opens your face, it fills the mouth. Now, if you have a single tooth that's fallen out in the front of your mouth, maybe with an accident or something that happened to the tooth, show us an example of a single tooth mini dental implant.
John, common procedure is upper front tooth that's in bad shape. If you bit into something, not necessarily anything hard, tooth breaks off the gum line, oh my goodness, what do we do now? In many cases, I can do this all in one visit. I can see you, remove the tooth painlessly, place the implant, mini dental implant, and place the new porcelain tooth right on there. So you can come in with that broken tooth or no tooth at all and walk out with a beautiful new tooth.
And that's made in America, and it's custom made for the patient. So that single tooth is not something that just comes out of a box. Talk to me a little bit, Doc, about sedation dentistry. I know that's something that you offer at your practice.
You know, fear of going to the dentist and dental procedures is a very real thing. Nobody really wants to go through these procedures. I fully understand that, but I'm here to help you. Oral sedation is what I can offer you. Oral sedation is a small pill which can certainly take the edge off and certainly works well for the vast majority of cases that I do. Make you comfortable enough. We'll still have lots of Novocaine when we do these procedures, and make this as comfortable as possible for you.
Because we really should make mention of that. If somebody has a fear of going to the dentist, for whatever reason, it might, like you said, it could be a previous situation where there was pain, or if it's affordability, we're making it affordable, and the pain is really gone. I mean, talk to us about how you feel after the mini dental implant procedure and what you need to take.
So the implant procedure, as we've talked about here, is a very minimally invasive procedure. Because we're not cutting gum, we're not stitching, we have a lot less discomfort after this procedure. Generally, what I'll recommend is a over-the-counter Tylenol or Advil. Most people describe this to me as like a dull ache for a day or two following the procedure, and generally that's it. There's no bleeding at the end of these procedures. It looks like nothing was almost done when you leave the chair.
It was totally painless.
What pain? I had no pain.
I didn't have any pain.
It didn't hurt.
I never felt a thing.
There was no pain, no discomfort whatsoever.
The entire procedure was virtually painless.
One trip, it's great.
One visit, you're done.
Less trips, the better.
It's actually really painless, and I wish I would have got it done a long time ago.
So I did it, and I'm very happy with it.
I took one Aleve that evening, and that was it.
And within an hour to an hour and 15 minutes, I walked out of here smiling and couldn't be happier, literally pain-free.
Yesterday, I had 4 implants put in here. I took 3 Aleve, and that was it.
It was good.
You want to go to Mint Mini Dental Implants, and they're at 360 Kidder Street in Wilkes-Barre. And you want to give Dr. Coolican and his team a call at 570-314-9177 and online at mintminidentalimplants.com. Dr. Coolican, we talked a little bit about your dad, and I'm sure he, obviously very proud of everything that you've done, but what is it really that gives you the inspiration to continue on as a dentist, particularly with this mini dental implant procedure?
Once I found this procedure and got trained in this procedure, I love the effects it has on my patients. I love what it can do for my patients. I love how I can take those removable dentures and partials and glue and remove all that and give a stable, beautiful smile, and people can enjoy their chewing. I can replace the missing teeth, and it's a minimally invasive procedure where we can get results literally in days or hours, not weeks and months.
Dr. John Coolican, you are an innovator in health right here in northeastern Pennsylvania, in Scranton, Wilkes-Barre, and everywhere in between. Thank you for joining us on the program.
Thank you very much.
And thank you for watching.